Hello, this is Katherine Neubauer. I'm a naturopathic oncologist practicing in Tulsa, Oklahoma, and I'd like to share some of my experiences in using the Microlight Laser with people with cancer. I know some of my colleagues are hesitant to use the laser in the oncology setting, and I'd like to encourage you that the oncology setting is actually a wonderful application of the laser because one of our primary goals in oncology is to enhance quality of life and to decrease the need for use of sedating pain medications so that the patient can be more aware and more functional. And that means that when treating people with cancer, that we're really interested in treating the whole person, in helping them be more comfortable in any way that we can. And I'd like to share with you some of the uses and successes that I've had with the Microlight Laser in a couple different areas. The first being in wound healing. It is wonderful for wound healing. It's really fun to see wounds just heal before my eyes. My most recent practice was in a large cancer hospital, and so we had a lot of major surgeries and the patients coming through, and we worked closely with the surgeon and the wound care department as far as healing up wounds. It's also particularly helpful with radiation if patients are getting radiation dermatitis or difficulties even with pelvic radiation. Isa Herrera's protocols as far as treating pelvic floor conditions have been wonderful for these patients, and really seen improvements in pain, in tissue quality, and also in decreasing some of the uncomfortable secretions that can come with radiation dermatitis. Another area where the laser has been very useful is in neuralgias and neuropathies. We work with quite a bit of peripheral neuropathy that's induced by chemotherapy, also patients who may have pre-existing diabetes or diabetic neuropathy, even long-standing cases I've seen respond very well to the laser. Neuralgias, things like tic douloureux, facial neuralgias have responded very well, sciatica as well. I've had patients who were understandably skeptical about the treatment, but would walk out of the room leaving their cane behind, folks with sciatica or failed back surgery. So just really helpful responses there. Another area where the laser is really useful is in inflammation. It's successfully treated patients with acute gout attacks. There, of course, we're looking to relieve pain and inflammation and increase mobility. The patient does have to address the underlying metabolic condition, but certainly I've had people come into my office limping and come out walking. Also, plantar fasciitis responds very well, sometimes sparing patients from unnecessary surgery. So those are some of the applications I would really recommend. If you're interested in more detail on some of the excellent research on using the laser with oncology patients, would invite you to look up the article that I wrote, Let There Be Light, on using laser in the oncology population, and that's available through the Microlight website. Take care, and if you have any further questions, you're welcome to contact me at restorationhealthcare.net.